Hello, warriors. Hello, healers. Welcome back to this episode. If you are listening to this on the Prepared Patient podcast or you're watching this on YouTube, I appreciate you being here. And my goal is to give you as much information as you need to make an informed decision to see if you want to take part of our March promotion IV vitamin therapy that will help you heal your body quicker and faster, that will help you feed your cells the nutrients that they need for them to work for you, that will help you decrease inflammation, get rid of toxins, give you some antiviral components to really boost your immunity. Okay. So in the last video, we talked about the 5 reasons why people dismiss IVs and they just like completely put it aside, like I don't want to do this thing doesn't work, there's not enough research, blah 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 blah. We talked about lack of knowledge, right? The misconception about IV, how you don't need to get IVs, you can get all the nutrients from your food. You can go purchase multivitamins and then you're gonna get that, or you can get some anti-inflammatory herbs and this is gonna help, right? If that was the case, then we all be healed. Right? Like nobody will be sick. As I mentioned, the food itself has a lot of preservatives, contaminants, right? Herbicides, pesticides, glyphosate. And the vitamins that we are ingesting, the nutrients that we purchase at the vitamin shop, the multivitamins or the immune viral herbs that you purchase in, you have to be mindful. Some of them will have binders and fillers and preservatives in them. So we talked about that. We also talked about price, how it is not covered by insurance, and how insurance can be a hindrance to healing our bodies because we want everything to be covered by insurance when healing doesn't take place when the insurance company is telling you what to do, okay, or telling the practitioners what to do. When it comes to IV vitamin therapy, which is part of a natural solution, you don't go to the vitamin shop and hand over your insurance card and say, hey, I want to buy this multivitamin, charge my insurance. No, it doesn't work that way. So we have to really use the insurance for what it is. And then if you're able to invest on the things that are not covered by insurance. So that's why in our clinic, we always have promotions every quarter where we are decreasing our fees so that people can experience different level of healing. So people can experience different tools and resources that can help them get to the other side. Because I know IV vitamin therapy can be a great add-on to whatever you're doing. IV vitamin therapy has been in existence, has been utilized for years before it's so popular now. And it is very popular now. And the third one was unrealistic expectations, how we think one bag, one infusion is going to give us all the improvement, all the results, right? And sometimes patients will tell me, well, Dr. J, I'm just going to try one and see how it goes. You might not feel anything with one because your deficiencies are so extreme, right? The inflammation is so much that your toxicity level is higher. So you might not feel nothing. So for you to think you can do one bag and expect results, we have to be realistic, right? Because your cells are depleted, they need help, and we don't know how much help they need. So that's why I usually recommend 4 IVs, right? Start with 4, but again, one infusion. You don't take one multivitamin and be like, oh, that's it. I'm not going to use the whole bottle, right? You don't eat healthy once and then like, that's it. I'm cured. So for us to take one infusion is going to give us the result. That is being realistic. And that's why sometimes we get stuck, right? To where we are, we don't cross over to the finish line or the other side, and we wonder why. You got to really assess. Yes, with one infusion, you can start seeing some improvement with infusions. And that happens a lot when people are dehydrated with those super hydration. They're like, oh my God, I feel good. Or when they have energy issues like fatigue, tiredness, we're doing an Energizer IV, they can get a boost of energy. But again, those improvements, those results are short-lived. So we do not think one infusion is going to give us the results. And then the next one is fear of needle phobic. Yes, I understand. Sometimes we have to do things we don't want to do to get the results that we want. And it is part of healing your body, right? Like being comfortable never give us the results. We have to get out of our comfort zone and be uncomfortable to get the results. So if you are doing what you're doing is giving you results, don't stop. But many of us know that what we're doing right now is not giving us the results. That's why we go see the doctors, we do the blood test, we seek help, right? Because we want something different. We want to feel better. We want to have more energy. We want to have more motivation. We want to have better moods. We want to have less digestive issues. We want to have more brighter skin. We want to lose weight, like all of the things we want to. So we have to be uncomfortable. And yes, sticking a needle or catheter in your arm can be a little uncomfortable, but we strive to keep it as painful, as painless as possible. Like you don't feel, sometimes you don't feel a stick, you don't feel anything. It's like going to LabCorp for blood tests. We really try to manage it to make sure that you feel nothing in our practice. And we only do 2 sticks. We do not go fishing around, poking around, looking for a vein. We don't do that here in our practice because yes, I myself is very needlephobic. So, I'm, I'm not okay with people looking and poking me and no. So we take our time, we look for the vein. When we see one, we go for it. Yes, there are possibilities the vein can blue. That happens all the time. Or if you come to us dehydrated, it might be a little challenging, but we do not poke around. Sometimes we lose money, right, on the side of the IV to make sure that, our patients feel comfortable, and safety is the number one thing for us so that you can leave our clinic, our space, not being traumatized. And then the last one is bad experience, terrible reviews. Yes, not all IV vitamin therapy clinics are created equal. You have to go to one that's only going to spend time with you, that's going to educate you. That's why we're doing these videos here. And that's also going to take time to make sure that your questions are being answered, right? With every single IV patients we have come into our clinic, we follow up with them. You will get a call from us, to check on you. How are you? How you doing? And if you do more than one infusions, we also ask how you're feeling. Because yes, we can do multiple infusions, but one thing that separates us from other clinics is that we listen to how you feel and we don't mind adding more nutrients so that you can feel your best, right? If you come to us and you have energy issues, right? And you say, well, you know what, I'm still tired, then we might add more of the nutrients that produces energy. So we always customize it to the best that we can so that you can feel a difference. But yes, there are some bad experiences. People go to IV places, they get infections, they get sent to the hospital, so on and so forth. That happens. That can happen with anything. But for us, we really manage, we make our IVs on site here. They are preservative free, they are potent, but we also manage our patients as well. We sit with you, we talk to you, we manage you, we follow up with you. We don't just put a needle on your arm and give you a whole bunch of fluid and then we're gone. And then you don't see us until, no, periodically we'll check on you. How you doing? And how you feeling? Like we're always asking questions because again, this is a tool that you can use that can give you results, right? We want to make sure that you are getting return on investment. And if you were to Google things, remember, Dr. Google, you're going to hear the good and the bad. Never really look at what you read on Google, right? Take it for a grain of salt. Ask questions, go to a clinic where they're going to monitor you. They're going to make sure that you leave exactly the way you walked in. That's exactly what we do in our space with IV vitamin therapy. So if you're looking at those 5 things, right? Lack of knowledge, misconception, price, not covered by insurance, unrealistic expectations. One bag will give you all the results. Fear of needles, stay comfortable. And also bad experience. I guarantee you, we know all that. We address all that in our space and you are in the right place. So if you want to participate in our promotions, March promotion, choose your IV for $250 minus the ozone and the NAD, please feel free to click the link below. Send us a message. You can DM us on Instagram. You can call us, right? 973-978, no, 31, no, 973-957-0871. I think that's the number. But Wellness Corner, New Jersey, that's us. We would love to help you experience the benefits, or maybe IV vitamin therapy might be a piece to your puzzle. Like there's so much you can do with IVs. There's so much you can do with IVs. And I want to show that to you in the month of March. That's why we are reducing our price so that people can actually experience, so that we don't keep, getting all these viruses that are out there and keep being sick and we don't know why. Like you're literally in control of all that is for you out there. Open your mind, open the capacity to receive, and don't just stick in one thing. Explore to see what's out there. And you never know. You never know what you're gonna find, and that might be the thing you've been looking for, right? So in the month of March 2024, choose your IV for $250. The promotion ends the third week of March, okay? And you have until end of April before summer comes to use the IVs. Right, so if you have any questions, reach out to us. Until then, I'll see you in the next video, and I so appreciate if you can share, subscribe to, with everyone that might benefit. Do not keep this information to yourself. Does no good. Sharing is caring, and I'll see you on the next video.